Hello and welcome to the UAB Comprehensive Transplant Institute. My name is Andrew Abele and I am a transplant social worker.
My name is Erin Carter, and I am a Transplant Financial Associate. In this video, we'll discuss the ways we prepare you for organ transplant and help you with social and financial issues during the process. Our goal today is to review some of the family, social, and financial questions you may have during the 5 phases of transplant. We'll also cover how the transplant social workers and financial coordinators can help you throughout this journey. These phases start with the period you're probably in right now, before being added to the transplant waiting list. Next, your needs will change once the evaluation is over and you are on the waiting list. The most intense period where you will see the biggest changes and probably need the most help is right after your transplant surgery. The first 3 months after transplant are important and when you will be adjusting to your new life with a transplant. Finally, you will continue to see your transplant team and need our help in future months and years as we partner in your health.
You will meet with a licensed social worker during your transplant evaluation. Our role is to meet with patients and caregivers, discuss their understanding about their disease, while learning if an organ transplant will be a good option for them. Some topics we cover are how much you know about why you need a transplant now, if there are times you choose not to take the advice of your doctors or nurses, do you have a good way to get back and forth to UAB, how much support you have from family and friends. You cannot do transplant by yourself. We just want to know who will be in your corner helping you get healthy and that they are supportive and able to drive you to and from your appointments at UAB. Why you want a transplant. Having a goal to focus on will help you get through the hard stuff. The transplant social worker you meet with is part of the group that will decide to add you to the waiting list. You may not be waitlisted directly after your evaluation. Oftentimes, patients need more time to identify additional caregivers, improve their transportation plan, or complete additional medical testing. This is on a case-by-case basis. The transplant financial coordinator will also meet with you during your evaluation, but this will be done by phone. Their role is to help with the money side of transplant by talking about your health insurance, how much you spend, and how much you bring in each month. While getting an organ transplant is a big decision about your body and health, it also has an impact on your finances. To make this phone call as useful as possible, please complete the budget form mailed to you before the financial coordinator calls you. This will make it easier for you to talk about how much money you have left over after paying bills to cover the cost of your transplant. Your financial coordinator will also review how much your transplant surgery and the new medicines will cost you, and this is after insurance covers their part. Transplant medicines are very expensive, so we want to try and predict how much this will cost you. Just like the social workers and the financial coordinators, share information that will be used to make a decision about adding you to the waiting list. You must identify 2 adult caregivers. Ideally, you would have several. Try your best to bring at least one of them to your evaluation clinic appointment. You are going to be hearing a lot of information during these clinic visits, and 2 sets of ears are always better than 1. You cannot do this alone. Look for people that can stay with you 24 hours a day, 7 days a week right after transplant, get you to and from clinic appointments until you are released to drive, which could be 1 to 3 months after transplant. Go to the grocery store and cook healthy meals until you feel up to do that yourself. Help you keep up with taking 5 to 10 new medicines 3 to 4 times a day. And if you have children, adults, or animals back home, someone will need to take care of them for at least a month while you are in Birmingham. Your caregiver needs to be at least 18 years old, able to drive you to UAB multiple times per week right after transplant, and able to take off work. Many employers allow their staff time off to take care of family. Your caregivers can rotate, taking care of you if needed. The form you see here will help them understand your needs, and you will receive a copy during your evaluation. Finally, they do not have to be a nurse or work in healthcare. They just need to care about you and agree to show up with you when you get the call for transplant.
Once on the waiting list, there are things you can do to get ready for transplant. The first is fundraising. It is very helpful to try to gather and save money now to help pay for the extra costs you'll have if you get transplanted. One of the best ways to do this is ask your friends and family for ideas to raise money. You should avoid the GoFundMe website because money raised through this company is counted as income to you, and this might cause you to lose benefits like SNAP, SSI, or Medicaid. Better fundraising options are through your social or faith groups and organizations like helphopelive.org and transplants.org. If you have health insurance besides traditional Medicare or Alabama Medicaid, it is helpful for you to call the phone number on the back of your insurance card to ask if UAB is in network for the kind of organ transplant you need. Not all insurance or Medicare Advantage plans are created equal. Some insurance companies will charge you more to be transplanted here, so it is important for you to check this now. If you are on dialysis, there are special rules about the benefits of Medicare Part A coverage and the coordination of benefits period that you need to know about. We also strongly encourage dialysis patients to obtain traditional Medicare because we have found that this saves you money after transplant. You will take a lot of new medicines after transplant, so it is important that you know how much these will cost you. Tell us if you have major life changes like moving out of state, losing a job, or changing insurance because these could make it harder to pay for a transplant at UAB. Our final advice while you are on the waiting list is to make sure you continue to have a way to get here when you get the call that an organ may be ready for you. This means you need a working cell phone and a good car or caregiver who can drive you to UAB anytime, day or night. Keep your cell phone on, charged, with a ringer you can hear, and tell us if your number changes. Also, you might come to UAB and find out the transplant will not proceed, so you would need a way to get home as quickly as 12 hours after you came.
Though it is the main goal we have for all patients, the transplant surgery is the shortest part of the whole process. Most patients will be in the hospital for 1 to 3 weeks, depending on the organ they have transplanted. After leaving the hospital, the team needs you to stay nearby so they can keep a close watch on you. Times in Birmingham range from 2 to 14 weeks, depending on which type of organ you receive. Your doctors and nurses will give you more specific estimate of how long you should expect to be in Birmingham. If you live near UAB, you will be able to go home right after you leave the hospital, then to be driven to frequent clinic appointments during this phase. If you live out of town, you will need to arrange for a place to stay. You can stay with family or friends that live near UAB or pay to stay nearby. The cost of lodging is your responsibility. One option is the UAB Hilton Hotel, which is 4 blocks from the hospital and has rates discounted based on patient income. Check with your health insurance plan to see if they will help pay for this temporary housing expense. The UAB Hilton offers a free shuttle to get you to clinic and lab visits, but if you stay elsewhere, you will need someone to drive you to doctor's visits and lab draws. You will not be able to drive for 2 to 4 weeks after you leave the hospital. Some patients try to get a short-term rental, like an Airbnb, or even stay in an RV at a campground, so they don't have to try and cook their meals in a hotel room. Of course, you still need to make sure your regular household expenses are covered while you are in Birmingham.
After your required stay in Birmingham to be close to your transplant team, you will be able to move back home. You will be adjusting to your new life with the transplant, and unfortunately, this will also be when you start to receive bills for your transplant care. This can be a stressful time, but keep in mind that the UAB billing office and your insurance company can help you. If you don't understand a bill you've received, call the number printed on it. If you still can't get the answer you need, call us and we may be able to help. Even though you'll be back at home, you will still have to come back to UAB for doctor visits that last a few hours, at least once a month for the first few months. You'll need to get lab work done at least every few weeks. Usually at UAB, though you may be able to get this done at a lab closer to home. Medicaid and some Medicare Advantage plans can help pay for rides to doctor visits, but these are limited and you have to plan ahead. We don't want these extra bills to cause you to spend less on food, rent, or utilities, so please contact your social worker to see if we can help with these emergencies. Talk with your employer about disability benefits offered. If you do not work and are disabled, apply for SSDI prior to transplant. Your transplant team can usually help with this paperwork for up to 1 year after transplant.
After the first 3 months following transplant, you will likely have fewer clinic visits and lab draws that require you to come to Birmingham. Even if you have a perfect post-transplant recovery, you will still need to come back to UAB to see your transplant team at least once per year. Some of our organ programs have follow-up clinics in other parts of the state, so be sure to ask your team if there's a clinic closer to your home. Your new medicines will keep your transplanted organ working, so it is very important that you keep taking them. If you are having any problems affording your medications, please let your social worker know immediately. They may have a program to reduce the cost. If you ever considered changing your insurance plan, please confirm that UAB is in their network, so you don't have to pay higher rates to come here. Call us for help if you can't get a clear answer from the insurance company you are considering. Some dialysis patients get help paying for health insurance from the American Kidney Fund. This assistance will end after you are transplanted, so you must have a plan for covering this insurance cost on your own. Our financial coordinators will help you with this. Also, for those on dialysis, transplant social workers have different duties from the social worker at your dialysis unit. You will have a main social worker assigned to you after transplant, and they are backed up by other team members. Unlike your dialysis social worker, we won't see you every time, but we are always just one phone call away. Reach out for things like how you can reduce the costs of your medicine, get mental health care, and to better understand the parts of your transplant journey that others have not been able to fully explain. Your transplant social worker and financial coordinator teams will be here to help you in the years after transplant. Thank you for taking the time to view this presentation, and thank you for choosing the UAB Comprehensive Transplant Institute for your care.